Are you experiencing pain in the front of your hip? Is it keeping you from doing the things you love and making your workday intolerable? Maybe it's just simply an annoying clicking or aching in the hip that won't go away. You may be dealing with the hip labrum tear, and today we're going to cover the anatomy, symptoms, diagnostics, and treatment options associated with hip labrum tears. Hip labrum tears are a common orthopedic injury that can occur in a variety of active patient populations. It involves a tear to the cartilage that runs along the rim of the hip socket. This cartilage serves as a means to add depth and stability to the hip joint, and it also acts as a buffer between the ball and socket portions of the joint as they move on one another. These injuries can be caused by either repetitive stress and repeated motions to the joint, or simply through a single acute injury or trauma. Individuals may be predisposed to these types of injuries due to their unique anatomy or build. Additionally, certain sports and even work-related activities may put you at a higher risk for this injury, dependent on the movements and positions that you have to get into with those tasks. When we look at the anatomy of the hip, you can see pretty clearly the shape of the joint and how it resembles a ball and socket. The femoral head, or the top portion of the leg, is the ball, and the acetabulum, which is a portion of your pelvis, is the socket that it fits into. This is a similar structure to the shoulder, but there are some distinct differences. The shoulder is a much more shallow joint, which allows for significant amounts of mobility, but it's inherently less stable and more vulnerable to dislocations and subluxations. Whereas the hip joint, it's very deep, and this provides a lot of coverage. This allows for a much more stable joint, but at the sacrifice of some of that mobility. Now, we all have the same pieces and parts in our hip, but they're not all identical in shape, size, and orientation. We all have differences in regards to the size of the ball and the size of the socket, in addition to the exact angle and orientation of how they fit into each other. These differences play a role in our posture. Think of someone who may be bow-legged or knock-kneed. They also influence how we move, such as how we squat, lunge, and perform other athletic movements. This is one of the reasons why we're all not able to squat perfectly to the same depth, and it's not simply just because of how strong or flexible we are. Some of these variances may also lead to increased stress or friction on the labrum with your day-to-day and athletic movements, and this can lead to accelerated wear and tear on the labrum. Hip labrum tears can present in a variety of different ways, but there's usually some common complaints that are often voiced by individuals. Pain, instability, tightness or a loss of motion, and weakness are often reported. Pain is typically described as sharp or aching, and it's in the front of the hip and towards the groin. Often it's exacerbated with longer periods of sitting, standing, or walking, and even higher impact activities such as running and jumping. Instability may come in the form of the leg feeling like it wants to give way when you get into certain positions or motions, and that's often accompanied with pain and weakness. A loss of range of motion or flexibility may be experienced for two different reasons. It may come from the labrum being torn and physically restricting how the joint moves because it's getting pinched or stuck in different positions. It may also come simply from surrounding muscles guarding and just trying to protect that area because the joint is painful or unstable. An interesting thing to note though with hip labrum tears is that they don't always have symptoms. Oftentimes people can develop a hip labrum tear and it's unknown until they pursue imaging or medical attention for a different injury altogether. As with most injuries, the treatment for labral tears will vary from person to person. Some will be able to get away with just conservative treatment, while others may require surgery. Typically, your level of pain, your functional status, and your lifestyle are going to influence which is the most appropriate choice for you. Conservative measures may include activity modification, medications, and physical therapy. Modifying activity is intended to minimize the amount of times that we're aggravating the area. This will help reduce inflammation and allow the area to recover. Medications may include painkillers or anti-inflammatories. Oftentimes, one will be advised to start with over-the-counter medications, but they could progress towards higher strength prescription medications if symptoms persist or are just more severe. If oral medications are not providing relief, the physician may opt for an injection, such as cortisone, directly into the painful area. Physical therapy will be utilized for pain relief and also to restore function of the hip by normalizing range of motion and strength. An evaluation will help identify what movement limitations may be contributing to your symptoms and injury, and also what impairments may be a result of the injury. The findings of the exam will guide your individualized plan of care.